Podcast 11 of the Upper Limb series, The Blood Supply of the Upper Limb. This podcast is going to detail the arterial supply to and the venous drainage from the upper limb. So let's start with the arterial supply. Each upper limb is supplied by a single artery, the subclavian. The left subclavian artery is a branch of the aortic arch, whilst the right subclavian artery comes from the brachiocephalic trunk. As each of these subclavian arteries extend laterally towards the axilla, it is posterior to the clavicle and is superior to the first rib. Along this path, each subclavian artery gives off several branches, including the vertebral artery, the thyrocervical trunk, the internal thoracic artery, and the costocervical trunk. So let's detail some of these branches. The vertebral arteries supply structures in the brain, whilst the thyrocervical trunk gives branches to the thyroid gland and the muscles of the neck. The internal thoracic arteries supplies the intercostal muscles, and the costocervical trunk, which also supplies some intercostal muscles and some muscles in the neck. So as the subclavian artery passes the lateral border of the first rib, it becomes the auxiliary artery, and enters the axilla via the cervico-auxiliary canal. As it enters the axilla, it runs alongside the auxiliary vein and also the brachial plexus. The auxiliary artery can be divided into three parts in relation to the pectoralis minor muscle. The first part of the auxiliary artery is in between the lateral border of the first rib and the medial border of pectoralis minor. The second part lies deep to pectoralis minor, and its third part extends from the lateral border of pectoralis minor to the inferior border of teres major, where it then continues through the arm as the brachial artery. The auxiliary artery has several branches which supply the surrounding musculature. The most significant branches come from its third part, which are the posterior and anterior circumflex arteries and also the subscapular artery. The anterior and posterior circumflex arteries anastomose to form a collateral circulation around the surgical neck of the humerus. The subscapular artery also comes from the third part and has an important role in forming collateral circulation around the scapula. As the auxiliary artery exits the axilla, it becomes the brachial artery. The brachial artery runs distally along the medial side of the humerus, where it gives off the deep artery of the arm, also known as the profunda brachii. This is the largest branch of the brachial artery and extends around the posterior aspect of the humerus in the radial groove, and it supplies triceps brachii. Also branching from the brachial artery are numerous muscular branches, and these supply the muscles of the arm's anterior compartment. As the brachial artery continues down the humerus, it enters the cubital fossa lateral to the median nerve, and medial to the tendon of biceps brachii. I detailed this arrangement in podcast 6, and you should remember the mnemonic TAN, which from lateral to medial stands for biceps brachii tendon, the brachial artery, and the median nerve. Before it enters the cubital fossa, the brachial artery gives off two ulnar collateral arteries. These travel medially from the brachial artery and anastomose with branches from the profunda brachii to supply the elbow joint. As the brachial artery passes through the cubital fossa, it terminates by dividing into the radial and ulnar arteries. The radial artery emerges from the brachial artery at the inferior aspect of the cubital fossa, and it then travels infralaterally towards the hand deep to brachioradialis. At the wrist, the radial artery lies lateral to the tendon of flexor carpi radialis, and this superficial location makes an ideal site for taking the radial pulse. You can imagine the path of the radial artery by drawing an imaginary line from the midpoint of the cubital fossa to just medial of the radial styloid process. The ulnar artery emerges from the brachial artery as it extends inferiorly deep to flexor digitorum superficialis. It then joins the ulnar nerve and forms the ulnar neurovascular bundle. At the wrist, the ulnar artery lies lateral to the tendon of flexor carpi ulnaris, and the ulnar pulse can be palpated here. The first branch of the ulnar artery is the common interosseous, and this quickly divides into the anterior and posterior branches to supply most of the musculature within the forearm. The posterior interosseous artery enters the posterior compartment by penetrating the superior aperture of the interosseous membrane. The anterior interosseous artery extends along the anterior surface of the interosseous membrane, supplying the deep musculature within the anterior compartment. The structures within the hand are supplied by both the ulnar and radial arteries that form two palmar arches, the superficial and the deep. The radial artery enters the hand by curving dorsally over the lateral aspect of the wrist to run along the floor of the anatomical snuff box. From the anatomical snuff box, it passes into the palm by turning medially past the two heads of adductor pollicis. It then continues to form an anastomosis with the deep branch of the ulnar artery at the level of the metacarpal basis. The union between the ulnar artery and the radial artery, deep to the long tendons of flexor digitorum, is the deep palmar arch. The deep palmar arch gives off branches to the thumb, the princeps pollicis, the index finger, radialis indicis, and the three palmar metacarpal arteries. The ulnar artery enters the palm by passing superficial to the carpal tunnel alongside the ulnar nerve in the ulnar canal. It then divides into two branches. A deep branch that extends along the medial border of the hand and then turns laterally to join the radial artery and form the deep palmar arch. The other branch is the superficial branch, and this extends under the tough palmar aponeurosis as the superficial palmar arch. It gives off several digital arteries that run either side of the second and fourth fingers. The superficial branch terminates by joining the radial artery. This complex arrangement of deep and superficial palmar arches is important in maintaining an adequate blood supply to the hand. As the hand can assume complex positions, it is possible that some arteries can become occluded, and the presence of these two palmar arches, formed by the ulnar and the radial arteries, helps to maintain sufficient circulation. So now let's turn to the venous drainage of the upper limb, and let's start distally in the hand. The venous drainage is very similar to the arterial supply, with there being both superficial and deep venous arches within the hand, and these drain into accompanying veins that run alongside the radial and ulnar arteries. The accompanying veins are usually paired and are also referred to as the venae comitants. These two deep accompanying veins then unite and extend proximally to run alongside the brachial artery in the arm as the brachial vein. Also returning venous blood from the upper limb is a pair of superficial veins. These are the basilic and the cephalic veins. They originate from the dorsal venous network on the dorsum of the hand and run in the subcutaneous tissue of the forearm. The basilic vein runs along the medial aspect, whilst the cephalic vein is more lateral. At the cubital fossa, the cephalic and basilic veins communicate via the median cubital vein. This runs in the roof of the cubital fossa, and due to its superficial location, the median cubital vein is a common site of venipuncture. Within the arm, the basilic vein stays medial and runs parallel to the brachial artery. It merges with the deeper brachial vein and forms the auxiliary vein. The cephalic vein continues superficially along the lateral aspect of the arm, and then runs between the deltoid and pectoralis major muscles in the deltopectoral groove. It then joins the auxiliary vein. The auxiliary vein then leaves the axilla and becomes the subclavian vein. The two subclavian veins drain into the brachiocephalic veins, which themselves unite to form the superior vena cava, which empties into the right atrium. So in this podcast, I've detailed the arterial supply and venous drainage of the upper limb. In the next podcast, number 12, I'll detail the joints of the upper limb.